Welcome to the deep dive. Today we're plunging headfirst into something pretty stark, almost terrifying actually. Our world seems to be teetering on the edge of a healthcare crisis, one unlike anything we faced before. And frankly, our traditional systems, well, they're failing us. Now just try to imagine this future. Doctors actually refusing to see patients, not out of malice, no, but out of a very real kind of existential fear of infection. For themselves, for their families. Picture a world where, common illnesses, things we barely think about today, become genuine death sentences. And maybe the most chilling part, imagine our autonomy, our control over our own health, just eroding bit by bit until we feel completely helpless. Look, this isn't some far-fetched sci-fi plot. This is the post-antibiotic era. It's already starting to unfold. And it's being amplified by these deep systemic failures in our current healthcare setup. So in this deep dive, our mission is to unpack a really provocative, maybe even revolutionary concept. The vision behind Dr. Maya AI. And this isn't just another symptom checker app, okay?
Our sources paint it as a system designed not just to, treat symptoms, but to fundamentally transform our relationship with health itself, to actively prevent future pandemics, and crucially, to help us reclaim our agency, our power over our own well-being. We're going to dig deep into the alarming truth about where things are going wrong right now, and then explore this revolutionary but also surprisingly anciently rooted solution. A solution that our sources argue isn't just an option anymore. They're saying it's a mandatory shift for humanity. Our sources today are, well, a compelling mix. Sometimes unsettling, honestly. We've got extensive research on antimicrobial resistance AMR. We've looked at Dr. Maya's own detailed business plans, the tech specs. There are these profound philosophical texts on free will and autonomy. Plus, a really powerful, very personal autobiography from the system's creator, and even some fascinating insights from, believe it or not, quantum physics and ancient wisdom traditions like Ayurveda. You've asked us to be blunt, to be honest, to pull no punches, and honestly, the sources themselves demand it. The urgency is palpable. So yeah, let's unpack this.
Okay, let's start with this terrifying reality. It's not just on the horizon, it's here, the post-antibiotic era. This isn't some distant threat. It's a global public health crisis happening right now. And it's driven by something called antimicrobial resistance, or AMR. The World Health Organization, the WHO, they don't mince words. They call AMR one of the most urgent health threats of our time.
Mm-hmm.
And that's not hyperbole. Not when you look at the sheer scale of the problem. The current numbers are already shocking, really shocking. We're talking about an estimated 35,000 deaths every year just in the U.S. because of AMR, globally. 700,000 deaths each year. Now, if we keep going like this, projections suggest that by 2050, that number could skyrocket to a truly horrifying 10 million deaths annually.
10 million. Just let that sink in for a moment.
Yeah. It's more than currently die from cancer. It's like losing the entire population of New York City every single year.
And it's crucial to understand this isn't just about antibiotics for bacterial infections, though that's a huge part of it. We're seeing similar resistance problems across the board. Antivirals, for things like HIV, antiparasitics for malaria, even antifungals. We have emerging threats like Candida auris that are becoming incredibly difficult to treat. It's systemic.
And what's really disheartening, maybe even frustrating, is that this wasn't unforeseen, right? It didn't blindside us. Dr. Alexander Fleming, the guy who discovered penicillin, he warned us.
Yeah.
He warned about this potential for resistance way back in 1954.
He did. He saw it coming, almost like a built-in consequence of his own incredible discovery.
Penicillin itself, discovered in 1928, was almost an accident, wasn't it? A fungal contaminant in a lab dish.
That's right. It changed medicine forever. But Fleming's warnings about misusing it, well, they largely went unheeded for decades.
So how do they do it? How do these tiny bacteria develop such incredible, almost like devious resistance?
Well, bacteria are incredibly adaptable. You could almost say intelligent in their own way. They don't just develop resistance, they share it. They swap these immunity genes around like kids' trading cards, even between completely different species. They can become resistant through simple random changes in their own DNA, a gene mutation that suddenly makes a drug useless against them. But what's really unsettling, and why resistance spreads so fast globally, is something called horizontal gene transfer.
Horizontal gene transfer, like passing notes in class.
Sort of. Think of it like passing cheat codes to each other. They can do it in a few ways. Transformation, where they just grab bits of DNA floating around them. Transduction, where viruses accidentally carry resistance genes from one bacterium to another. And conjugation, which is like direct cell-to-cell contact, a data transfer almost. We see the results in things like beta-lactamase enzymes, which just chew up penicillin, or the TET-M protein that stops tetracycline from working. These mechanisms explain the rapid spread. It's why our antibiotics are failing faster than we can possibly invent new ones.
And the result of all this bacterial cleverness and, well, our inaction, superbugs. The WHO even published a list back in 2017, 12 urgent bacterial threats, like a global most wanted list for pathogens.
And the language used in our sources to describe them is powerful. They call superbugs a holocaust, quick and deadly for no medicine and vaccine to stop.
That's incredibly stark language.
It is, but it really drives home the ultimate fear, a complete breakdown of our medical toolkit, leaving us basically defenseless against infections that used to be simple to treat.
And this is where, well, where we have to look at ourselves, isn't it? Humanity's role. Our actions, maybe with good intentions initially, have massively accelerated this crisis.
Absolutely. One of the biggest factors highlighted in the sources is the widespread use of antibiotics in agriculture.
Not just for treating sick animals, right?
Exactly. Often they're used routinely as growth promoters in healthy livestock, just to make them grow bigger, faster.
Which creates this huge, essentially uncontrolled experiment.
Precisely, a massive reservoir of resistant bacteria. And these drug-resistant bugs, like certain types of salmonella, they don't stay on the farm. They easily pass through the food chain, reach us, and then spread globally through trade and travel. It's a self-inflicted wound, really, a vicious cycle we've created.
A silent, self-inflicted wound. That's a chilling thought.
And this wound has profound implications, especially for people on the front lines. Healthcare workers. When you think about the threat to them in a post-antibiotic world, it gets even more serious. I mean, if common infections become untreatable, potentially fatal, would you take that risk every day? Healthcare professionals might simply decide they can't. The creator of the system we're discussing, Dr. Srivatsa, he saw this firsthand. He worked in isolation centers. He saw terrified health workers during outbreaks, staff reluctant, sometimes even refusing to treat patients. He saw colleagues die from infections that should have been manageable.
Wow. So it's not theoretical. It's a lived fear.
It's a lived fear. Imagine the moral distress, wanting to help, sworn to help, but facing a real threat to your own life, your family. It fundamentally undermines care.
And the hospitals themselves. They're supposed to be places of healing, but they can become danger zones.
Paradoxically, yes. They can become hotbeds for these superbugs. The sources mention a study, 400 hospital patients tested. A startling 15% tested positive for a superbug, like MRSA, early in their stay. It was already on their skin, in their noses.
15%, just from being admitted.
And it wasn't just the patients. Objects they touched, like the call button in their room, tested positive. The study estimated a 90% chance that anyone touching that button and the patient would also get contaminated. Even 20% of the room's equipment tested positive.
That's terrifying. It makes you question just going to a hospital if you're not critically ill.
It really highlights the risk, doesn't it? So if healthcare workers, understandably, start to retreat from this risk, who provides the care, it leads inevitably to a system breakdown. The most vulnerable are left stranded. And this, the sources argue, is why a fundamental shift is not just a good idea, it's mandatory.
Right. So AMR, the threat to healthcare workers, these are huge problems. But you're saying they're also symptoms of deeper systemic failures.
Exactly. Cracks in the very foundation of conventional healthcare that make everything worse.
Okay, let's dig into those structural cracks. First up, diagnostic errors. The numbers you mentioned are jarring. Roughly 5% of adults in outpatient settings get misdiagnosed each year, and over half of those errors could cause serious harm.
Delayed treatment, wrong treatment, worse outcomes. It's a huge issue.
And in hospitals, it's even worse. 23% of patients experience a diagnostic error, and 17% of those are harmful.
That's what the data suggests. Think about the ripple effect, wasted resources, emotional trauma, declining health. It erodes trust completely.
Okay. Then there's polypharmacy, taking multiple medications. It sounds common, almost normal now.
It is common, too common. And it's not just inconvenient, it's a massive burden. Financially, it's linked to a nearly 200% increase in total healthcare spending.
200%.
Pharmacy costs jump almost 290%. Non-pharmacy costs up nearly 80%. But the money is just the tip of the iceberg. The real chilling part is how the treatment itself, piling on drugs, becomes a direct path to new harm. It's a silent danger.
How so? Clinically?
Clinically, it dramatically increases risk. Patients on multiple meds are almost 20% more likely to end up back in the hospital and 25% more likely to die.
Wow. Those hazard ratios, they're stark.
And the risk of prescribing errors, through the roof. 30% error rate for 5 or more meds, nearly 50% for 10 or more. It's direct cascading harm that the current system struggles to prevent.
And even technology, the algorithmic medicine, the symptom checkers,
Yeah.
meant to help. They have problems too.
Big problems. Many have fundamental flaws. They often focus on one symptom at a time, analyzing sequentially.
Instead of looking at the whole picture.
Exactly. Experienced doctors look for patterns, symptom clusters. These apps often use rigid yes-no decision trees. They oversimplify complex conditions. They lack nuanced pattern recognition.
And who's building them?
That's another issue. Many developers aren't medically qualified. They're entrepreneurs, tech people. This leads to poor accuracy, sometimes as low as 19%, maybe up to 54%.
Less than a coin toss in some cases.
Right. And the real danger is just suppressing symptoms without finding the root cause. This can lead to deeper-rooted problems, treatment dependency. The person ends up less healthy overall.
Which leads to this idea you mentioned, manufacturer dependency. How does that work?
Well, the sources argue quite bluntly that these systemic failures, whether intentional or not, create dependency. By making systems complex, opaque, hard to navigate, by not providing clear, transparent information, institutions ensure people have to rely on professionals, even for minor things.
So it undermines our autonomy, our free will regarding our own health.
Profoundly. It fosters learned helplessness. It infantilizes adults, treating us like we can't understand our own body.
And the sources suggest profit motives are involved.
They make a very direct critique. They quote, referring specifically to the NHS in the UK, but applicable more broadly. The NHS is perpetuating the wrong of replacing and rationing healthcare by reducing access to medical doctors and replacing their positions with a lesser-trained medical practitioner, the nurses.
That's a strong claim.
It is. They see it as a deliberate strategy to cut costs, boost profits, even if it compromises care and leads to patient harm. It puts institutional interests, financial gain, ahead of the individual's well-being, dignity, and agency. They even critique traditional charity models for sometimes fostering dependence instead of dignity and self-reliance, arguing it violates deeper laws of karma by preventing empowerment.
Okay, so this paints a pretty bleak picture. But it brings us to the potential solution our sources champion, Dr. Maya AI. This is positioned as a truly revolutionary approach, aiming to tackle these failures head-on. A mandatory shift, they argue. At its heart, it's a vision blending ancient wisdom with modern AI. And the brain behind it, the visionary, is Dr. Kadiyali Srivatsa.
His personal story is quite remarkable and directly fuels the app's purpose.
Tell us about that, the typhoid story.
Yeah. When he was just 12, he got sick. A doctor misdiagnosed him with typhoid, but his own gut feeling, his intuition, said otherwise. He ended up self-medicating with quinine for malaria, and he got better.
Wow. At 12.
At 12. And that moment was pivotal. He realized illness isn't just tests and labels, it's the story of the illness as I have lived and remembered. That experience ignited his mission to empower patients.
And his career has been a fight against substandard care.
A decades-long battle against what he calls substandard care, negligent care, false claims. He was even removed from the performers list in the UK after challenging practices he saw as unsafe nurses, diagnosing and treating without, in his view, adequate qualifications.
But the court supported him.
Ultimately, yes. Both the High Court and Supreme Court judges backed his claim, validating his concerns about patient safety. He saw it as a fight against social injustice, a plot, as he puts it, by systems like the NHS to prioritize profit over patients by replacing doctors with less qualified staff. This just hardened his resolve for change.
And his focus on superbugs, the elephant in doctor's room,
Yeah.
that came from personal experience too.
A truly horrific one. In 1989, he witnessed his first MRSA death, a 14-year-old boy, dying, turning black from the feet up from an untreatable infection.
God, how awful.
It led him to this controversial experiment. He insisted parts of a hospital be left uncleaned to compare infection rates.
Uncleaned? That sounds counterintuitive.
Completely. But the results were shocking. The dirty hospital section had better patient outcomes.
How is that possible?
His conclusion was radical. The constant aggressive cleaning, the fumigation, it was killing the good germs, the beneficial microbes that naturally compete with and suppress the bad ones. We were creating sterile environments where superbugs could thrive without competition. It flipped conventional infection control on its head.
So this deep understanding, born from personal experience and these radical insights, that's the foundation of Dr. Maya.
Absolutely. The name itself tells you. May I medical advice you assess? It's designed to decode how doctors derive a diagnosis, to break that illusion of dependency that disempowers people. Its purpose is simple, powerful: heal, prevent, protect humanity by putting agency back where it belongs with the individual.
Okay, so how does it actually work? The core mechanism, this color-coded triad system.
Right. This is where it fundamentally differs from those flawed symptom checkers we talked about. Instead of looking at symptoms one by one, linearly, Dr. Maya uses a 3-symptom triad methodology. It requires a pattern.
Directly addressing the limitations of the other apps.
Directly. It's designed to emulate human diagnostic thinking. Real pattern-based diagnosis, like experienced doctors use, not rigid yes-no flowcharts.
You said this connects to ancient wisdom.
Remarkably so. Think of the Charaka Samhita, the ancient Ayurvedic text from India, 1500 BC to 2nd century AD. It emphasized tridosha pattern recognition, looking at combinations of symptoms, multiple signs, holistic assessment. Dr. Maya is essentially digitalizing that timeless approach.
Okay, let's break down the colors. They're key to the triage, right?
Yeah, absolutely. They're designed for immediate, clear action. Red means emergency. Call your local emergency number, 999 in the UK. Go to the hospital immediately. Do not drive yourself. This is for obvious life threats. Severe chest pain, stroke signs, major bleeding. Now, if it's just one red only, say, an isolated severe headache, no other symptoms, or one fainting spell, the advice is still cautious. Speak to a doctor. Recognizes potential severity even in isolation.
Okay. Red is emergency or urgent doctor contact. What about yellow?
Yellow means urgent, but not necessarily a 999 call. If you have 2 red plus 1 other symptom, it advises, book an urgent GP appointment for immediate evaluation and tests. If it's 1 red plus 2 yellow-green, the advice is, speak to a doctor for advice as this needs attention. It guides you to the right level of care, GP, urgent care, avoiding unnecessary emergency room visits, but ensuring timely assessment.
Makes sense. And green?
Green implies less urgent. Things like a mild cough and sniffles. Here, the advice shifts towards self-care or non-emergency contact. Consult NHS 111 or nurse triage to confirm self-management.
Got it. And then there's blue. This sounds critical.
BLUE is the infection caution override. This is paramount, especially now. It's specifically for infectious diseases and always prioritizes isolation and remote contact first. If you have 3 BLUE symptoms suggesting a highly probable infection, it's stay isolated and call your emergency number immediately. For 2 BLUE plus 1 other, it's isolate and speak to a doctor urgently. Do not visit hospital or clinic without prior arrangement. Key point: prevent spread. And for 1 BLUE plus 2 any other symptoms, it's stay isolated, call NHS 111 or speak to a nurse triage service. This whole blue category is a direct response to the dangers of spreading infections, especially superbugs, in healthcare settings. It reflects that mandatory shift in thinking.
Okay. Now, you mentioned a potential inconsistency about advice for single symptoms versus the never give advice for single symptoms rule.
Right. It's a nuance in the existing protocols mentioned in the sources. Advice is given for 1 red only or 1 yellow only, which seems to contradict the no single symptom advice rule. It highlights a design challenge. Dr. Maya needs a super clear, consistent policy. Maybe refine the 1 or 8 advice to scream emergency action. And for other single symptoms, perhaps lean more towards self-care or prompting for more symptoms before giving stronger advice. It's about balancing caution and avoiding over-triage.
And it adapts the advice based on the person.
Critically important, yes. It incorporates risk filters. Age is a factor. More cautious advice for older adults, say over 60 or 65. Physiological state matters: pregnancy, recent pregnancy. Immunocompromised status is key: cancer patients, transplant recipients, those on immunosuppressants get adjusted, more careful guidance. And underlying chronic conditions, diabetes, heart disease, are factored in because they change the context. It provides tailored, not generic advice.
And it aims to be easy to understand.
That's crucial for empowerment. The goal is simple to understand, perfect and clear protocols. It gives an initial simple answer, but then offers options, more details, or medical explanation. This caters to different levels of health literacy. You get quick guidance if needed, but the deeper understanding is there if you want it. Intuitive, even under stress.
So Dr. Maya isn't just a concept. The sources say it's validated, even by ChatGPT.
Yeah, the sources make that claim. ChatGPT's recognition of his genius should catalyze our own recognition. It's an interesting point about the system's logical coherence, perhaps, but the real validation comes from the data, the practical results.
Right, like the accuracy. Requiring 3 symptoms helps.
Significantly, it reduces spurious correlations that lead to false positive results. You need a more complete pattern, not just one or two potentially random symptoms.
So it avoids the vague or wrong suggestions you get elsewhere.
Exactly. It addresses that poor diagnostic accuracy, the 19% to 54% range of other checkers. Dr. Maya offers much greater diagnostic specificity, more reliable, actionable guidance, cuts through the noise.
And the impact on how quickly people get diagnosed. You mentioned data.
Yes, really compelling data from a Kaplan-Meier curve analysis comparing Maya users to a control group. The median time to diagnosis for Maya users was just 4 hours. For the control group, 24 hours.
4 hours versus 24, that's huge.
It is. And looking at the 90th percentile, the point where 90% of users got a diagnosis, Maya users took 12 hours. The control group took 48 hours.
2 full days versus half a day.
It shows a statistically significant leftward shift on the curve. Dr. Maya drastically speeds up diagnosis. And in emergencies or pandemics, those hours, even minutes, can literally save lives.
Beyond speed, what about reducing unnecessary trips to the doctor?
Big impact there, too. It helps people considerably cut down on the visits to the doctor, saves money by avoiding unnecessary tests or repeated appointments from wrong or vague initial advice. By empowering people to confidently manage normal and trivial ailments at home, it frees up healthcare workers and resources for the really critical stuff. It optimizes the whole system.
And less anxiety for the patient, too.
That's a huge, often overlooked benefit, knowing what's likely going on, knowing what steps to take quickly and clearly. It transforms that fear and uncertainty into informed action. That's incredibly valuable. And what's really fascinating, I think, is that Dr. Maya goes beyond just symptoms. It embodies this really deep, holistic philosophy centered on patient autonomy and free will. It's a fundamental break from what the sources call control-based healthcare. By giving people accessible knowledge, it directly fights that manufactured dependency we talked about, the kind created by complex, opaque systems. It even challenges quite directly those traditional charity models that might inadvertently create dependence instead of fostering dignity and self-reliance. It's about giving tools, not just aid.
And this connects to deeper philosophical ideas, free will.
Absolutely. There's a direct line drawn to Krishna's teaching in the Bhagavad Gita. Love me, but do not surrender your free will. Dr. Maya provides guidance, information, but ultimately preserves patient autonomy. It empowers you to make informed choices, which aligns perfectly with modern bioethics, informed consent, self-determination, guidance, not control.
The sources also talk about awareness, how our minds work.
Yes, this is a really interesting layer. The philosophy suggests our minds are receivers, filters, storytellers, and that awareness is your greatest tool. Dr. Maya is seen as a tool to help cultivate that awareness, to help you observe your own mind, notice those triggers for fear, anger, doubt, and break those cycles before they take hold.
Like interrupting a conditioned thought loop.
Exactly, breaking the loop. Allowing for more conscious decisions, it acknowledges that choices aren't always fully conscious, they're influenced by unseen forces, but we retain a veto power. It's about reclaiming mental agency, too.
And how does this focus on free will impact society more broadly?
Well, the sources argue that the belief in free will, even if it's constrained, is crucial for society. It underpins our moral systems, justice, social cohesion. By preserving and enhancing free will in healthcare, Dr. Maya supports that societal fabric. It allows individuals to remain moral agents responsible for their actions. It all ties back to that holistic view, echoing Ayurveda. Health is a combination of sharira, body, indriya, senses, sattva, psyche, and atma, soul. It's whole person well-being.
Okay, so individual empowerment is key.
Oh.
But what about the community? Pandemic prevention seems like a huge focus here.
A critical one. Dr. Maya's approach enables robust infection control without traditional infrastructure. Think about it. During a pandemic, you don't necessarily need huge centralized testing centers anymore, which can become infection hotspots themselves. Maya shifts initial assessment to the home. Decentralized, accessible.
And that blue category is central to this.
Absolutely. It encourages voluntary self-isolation for infectious symptoms. This creates effective containment without coercive mandates.
Which can often backfire, right? Create resentment.
Exactly. Instead, this empowers people with the why. It helps build understanding and responsibility. And this organically creates community-based surveillance networks. Outbreaks get detected much earlier, allowing targeted action before things explode.
Because people understand why they need to isolate.
Precisely. We know people show much higher voluntary compliance when they understand the reasoning, compared to just being subjected to fear-based messaging or authoritarian mandates. Dr. Maya fosters that understanding. It builds trust. It shifts public health from top-down dictation to a collaborative, informed effort.
And it physically reduces spread in clinics and hospitals.
Yes, by keeping infectious people home when appropriate, the blue category cases, it directly reduces the healthcare-associated transmission that exacerbates pandemic spread. Fewer infected people in crowded waiting rooms means less risk for other patients, less risk for those vital healthcare workers. Hugely important for preventing superbug spread, too.
And it's cost-effective.
Very. The sources cite a significant return on investment, $2.19 to $10 saved for every $1 invested, mostly through fewer hospitalizations and better treatment adherence because the guidance is clearer and earlier. Prevention is always cheaper than cure. It's a win-win. So how does this translate into practical, real-world solutions? How do we implement Dr. Maya? First off, accessibility is paramount. It uses electronic information phone, laptop, making it reachable anywhere. And crucially, it's designed to be free and friendly to navigate, especially for developing nations, breaking down economic and geographic barriers, truly democratizing health info.
And reducing the strain on doctors' offices and hospitals.
Massively. By helping people handle normal and trivial ailments confidently, it cuts down on unnecessary appointments. This frees up those healthcare workers, doctors, nurses to focus on serious emergencies and complex cases. As the sources say, this reduction in clinic traffic also naturally lowers infection spread in those settings, a vital benefit when doctors themselves are wary of infection risk.
Does it connect you to actual doctors, too?
Yes, it integrates with existing care. There's a video icon to book appointments with experts, physicians, conveniently. Options to call hospitals or doctors directly for advice. It offers routine appointments, screening, medication reviews, prescriptions, nutrition counseling, mental health support, even some urgent care coordination. The goal is seamless remote access, like an office visit, but safer and more convenient.
And for future pandemics, how does it help proactively?
Its design allows for prompt recognition and containment. Identifying potentially infectious people early minimizes local transmission. This involves early symptom reporting via the app, clear guidance on isolation, blue category, individual infection control measures, and monitoring, all guided by the system. And it learns. Every interaction symptoms entered, advice given, outcomes feeds back into the central AI model. It uses federated learning to continuously refine the symptom triads, improve accuracy for different regions and populations, adapting to new threats. Plus, it supports local language and cultural adaptations through AI translation, ensuring it's relevant everywhere.
Okay, the potential seems huge. But what happens if we don't change? If we stick with the current models?
The sources paint a pretty dire picture. Continuing with traditional control models makes catastrophic outcomes increasingly likely.
Like losing our agency.
Exactly, a continued loss of human agency. If people are constantly conditioned to depend on authorities, treated as passive recipients, we lose the ability to think and act autonomously about our health. This creates vulnerable populations unable to adapt. It leads to that infantilization of adults, reading dependency, and this erosion of agency and health could even fuel a broader democratic decline as people lose practice in critical thinking and autonomous decision-making in such a vital part of life.
And history just keeps repeating.
It's an ugly and strange fact, as one source puts it. Diseases, outbreaks, bacterial infections, they recur. The bugs get smarter, stronger. And despite knowing better, we keep making the same mistakes focusing on reaction, not prevention and empowerment.
Compounded by a lack of new drugs.
Yes, the stagnation of innovation is critical. Since the mid-'80s, the pipeline for new antibiotics has run worryingly dry. Pharmaceutical companies face huge hurdles. Meanwhile, bacteria keep evolving resistance, sharing it around. We now have bacteria resistant to many, sometimes all, available drugs. We're losing the arms race.
And we ignore prevention.
Historically, yes, an almost exclusive focus on treatment. The sources mention a superbug conference focused entirely on incentives for new drugs, completely missing the power of prevention and patient empowerment. We have tools like the internet, social media to educate people on preventing infection spread through informed action. That's far more sustainable than just waiting for the next drug. Ignoring this, sticking to old models, it's choosing a path of escalating crisis, not just for health, but for our freedom. Which brings us to the call to action, really, what the sources urge us to do. They say, bluntly, stop listening to the lies, know the truth, and start trusting systems like Maya AI to protect yourself, your loved ones. The creator puts it profoundly. It is not the behavior that needs to be changed. It is the driver that triggers your imagination, thoughts, and feelings that requires the change. Maya provides that trigger, that new way of thinking, a shift from confusion to clarity.
And they frame it as digital dharma.
Yes. Using modern tech to fulfill that ancient duty to protect and heal, it aligns with the universal ethics, like the Rig Veda saying truth is one, sages call it by various names. The principle heal, prevent, protect mirrors classical Hindu medicine. It's about empowering people with knowledge, preventing suffering, protecting the vulnerable, fulfilling Dharma using today's tools. It's presented as an ethical imperative now.
A powerful framing.
And I'll finish with a personal plea from the source creator, which really captures the urgency. Do not be the one who watches evil people destroy the world, but be the one we use. The knowledge and experience to help protect family, friends, and community at large. It's an urgent call to embrace this kind of innovation, take responsibility in the face of a clear and present danger.
Wow. Okay, so we've navigated some really stark realities today. This silent, escalating threat of AMR. The deep systemic failures in healthcare, the way our own autonomy is being eroded. But crucially, we've also explored a really bold and honestly quite hopeful vision in Dr. Maya AI, a system leveraging ancient wisdom, cutting-edge AI to empower us, prevent pandemics, democratize health guidance, really shift the power back. So as you reflect on all this, here's something to maybe chew on. If our minds are receivers, filters, storytellers, and if our choices, especially when we're scared or unsure, often come from these unconscious conditioned loops, anxiety, confusion, helplessness, what kind of profound shifts could happen in our health, in our society? What if we collectively chose to integrate a tool like Dr. Maya, designed specifically to shine a light on those unseen forces, to foster real autonomy, to guide us towards healing, prevention, protection, not just protecting our bodies, but our entire healthcare systems, maybe even humanity itself? What stands out to you with this idea? AI as a guide to help you reclaim your decisions and ultimately reclaim your health in this challenging new era.